Okay, low back pain. I have a friend of mine who is struggling with some low back pain and asked me to put together a few poses for him, so I thought I would just put it on YouTube. I get enough requests for this. So the biggest thing you're thinking about is the quadratus lumborum, which is a little square-shaped muscle right here. It helps to deepen the lumbar curve. So in other words, if you do this and let your pelvis fall forward, you're compressing that low back space. So everything that we do today, I want you to think of this motion. So watch me right here. 3, 2, 1. I'm going to engage my belly so that I make more space in my low back right there. First pose that we could start in, which may or may not be accessible for you, is child's pose. So in child's pose, especially if you have low back issues, you want to keep your knees together. Anytime you come into this tabletop variation, you want to not let that pelvic tilt come into motion. You want to lift and work against the gravity, push your arms, push your knees into the ground, and then lift your belly up so that you have one long line of energy in your spine. The last part of that, people tend to look up here and you'll notice there's kind of a kink in my neck. So I'm going to keep my neck equal because you have a big connection with your suboccipital area, the very, very, very top of your neck, that has a connection with your sacrum. It's the top of that line of energy. So child's pose, you bring your weight back on your heels and then just begin to go ahead and round forward. If this isn't available, you can always put a bolster or a blanket or something right here, or even bring your hands forward and come into what's called rabbit or puppy. Rabbit is a little further ahead, but puppy is right here. And then as there's availability in your ankles and in your knees, you can start to work your hips back. You just want to make sure you don't tip your pelvis up towards the sky or your tailbone towards the sky. You soften it down while you're here and make that space. Another variation as you gain flexibility is to widen your knees, touch your big toes together, and then start to work those hips back, forehead down on the ground. Another movement you can do is, we have traditional cat and cow in yoga. So that's cow is to drop your belly, look up, let your sacrum come up, and then cow is to round down and make a big arch with your spine. For the lumbar area or the low back, you're going to push your hips behind your knees. So here you'll notice that it's at a nice right angle. I'm going to push them behind my knees, and then I'm just going to isolate just my low back. So I'm actually going to intentionally go in to an anterior tilt, which is forward, and then posterior, which is backward. Now you'll notice my thoracic spine aren't involved, my neck isn't involved. I'm really just trying to isolate my low back area, that just bony or boneless, if you will, area around my belly. It's all soft. There's not a lot of bony support. So we tend to compress our low back in that space quite a bit. So just rounding and flexing. Next, and you can flow all of these together too, start to move side to side. So you'll start to just kind of let your hips move laterally to both sides. One side will inevitably be tighter than the other. Now remember, I'm honoring my spine this whole time. I'm not letting that anterior tilt or that belly sag come into play. And then as I start to get some flexibility or movement, I'm going to kind of imagine like I'm scraping the sides of a peanut butter jar, and I'm going to kind of move back into child's and then come back forward, back into child's, then I can move to the other side. You can do these for 5 minutes if you have time in a day, 10 minutes. You can make this flow last for 20 minutes. Lots of different things that you can do to isolate this area. You can walk your hands forward just a little bit and start to come into a modified upward facing dog. So I'm gonna let my hips come down. I'm gonna try not to compress that low back. So I'm not gonna sag everything and let that space in the lumbar area be really, really big. I'm gonna keep that tailbone softened down. I'm gonna push my knees into the ground and then allow my back to arch. Now when I go back to child's pose, there's two very important things for the low back. First, I'm gonna pull my pubic bone and belly button closer together and then push my hands into the ground. And those two movements are gonna lead me back into child's pose. Then when I come forward, I'm gonna pull my hands into the ground, keep my tailbone softened down, come into upward facing dog, and then round, push, and do that by bringing your pelvic bone and your belly button closer together. I'm going to show a variation of pigeon next, though if you don't have a lot of hip flexibility, I'll show a variation on your back next. Pigeon is where one knee comes in between the hand at an angle, and then you soften down onto that hip. And this may be enough already. In fact, this may be too much. If that's the case, you can pull this other leg in a little bit, so you're at 2 angles, and then you'll face the front and start to walk your hands down a bit. Remember that little kink that we want to keep out of the neck. We don't want to look up, and we don't want to hang our head. We want to keep our spine even from tailbone to the bottom of the neck. To make this more intense, you can straighten that leg behind you, and to make it even more intense, you can begin to bow out over that side. And then you'll just be intentional. Whatever you do on one side, do on the other side. So find the variation that works for this side. As you all know, I preach this a lot in my classes. You're never going to be the same one side to another. That's just not how our body works. So one side will be tighter. We tend to shift back and forth from hip to hip. We tend to stand with our feet lateral. As we get tired, we let our pelvis kind of move forward. So after you've done these poses, what I tend to do, and this is what I tend to do at the end of a long day, I have low back issues too, and I sit at a desk for long periods of time. So I'm going to grab, I have this bolster, which is also kind of a foam roller, and then I have a yoga block. So I'm going to take this yoga block. If you're new to this, you're going to lay it flat. If you've got a little bit more experience, you're going to turn it on its side. And if you've got the most experience, or you know you have flexibility, you're going to turn it long ways. I'm going to do it in the medium, just to show you with this. So soles of the feet come close to the bottom, roll your spine up, and then set that block right at the edge of L5, S1. If you don't know where that is, it's right at the top of your crack. Sorry, but for those who don't know anatomy, that's where it is. So just right at the top of there, maybe a little higher, depending on your glutes. And you're just gonna lay here. You could lay here, I lay here for sometimes up to 5 or 10 minutes. As you gain flexibility, you'll start to feel the little in-between ligaments, between the ilium, the when you put your hands on your hips to yell at your kids, those are your ilium, your sacrum, the tailbone right there. And then as you've done this for a few months, you can start to stretch your hip flexors while you're in this by just letting one leg go at a time. Now, if you have extreme low back issues or extreme lordosis, meaning you have that anterior forward tilt in your pelvis, I do not recommend this. And you want to clear all of this with your medical professional, right? You want to be working with someone who knows your body really well before taking general advice from a YouTube video. So please honor your body, honor whatever they say to do. And then when you come out of this, you're going to really push your feet against the ground, lift your hips, and then roll down very slowly, one vertebrae at a time. Couple more things here. That pigeon stretch, you can do it from your back. So you'll just cross your leg over like a gentleman would in a chair. You'll just reach through that space. And then one of the things that I highly recommend is really rocking back and forth. Rocking is very sedative for your joints, right? You put a baby in the car, they get in the car, what do? They fall asleep. Why? Because it's this rhythmic movement. And so when you start to do that, coupled with long, deep breaths, it relieves a lot of tension and stress in your body, which your body is the vessel that houses your mental and spiritual self. So it's all going to manifest itself in your body. So if you rock side to side, and while you're rocking side to side, you're pulling this shape in towards yourself. The next thing you can do is go ahead and unthread your hands, and keeping this whole shape into your body, start to work it to the side and take a twist. So you want to imagine that someone's almost coming back and pulling your hip back towards the side you're twisting away from. And then if you want to increase that twist to your neck, you can look over your shoulder. And then whatever you do to one side, you just want to make sure you do it to the other side. My left side is my issues. When I had babies and I was raising babies, I was always holding them on my left hip. So at the end of the day, it's always my left hip that I tend to lean on. I tend to put my hand on my hip and lean to the side. So I'm always giving just a little extra careful attention to that side because it's the side I compensate on. Also, just a little pet peeve in yoga classes, they used to always start on the right, and they therefore spend more time on that side than the other, than the left side. So you make sure then you unravel your hands, take that twist. You can hug that knee even closer, Again, you're imagining pushing this away. You just want to make that QL. You want to pull it this way, and you want to pull its twisting fibers. This is why bending and twisting is really, really hard on this particular muscle, because we tend to not do it well. We tend to not hinge at the hips. You could add in a couple of final movements like happy baby. Happy baby, you want to keep your knees into your underarms, and then you want to be very intentional. Keep your hips down. So I'm going to reach for my ankles. I can even just hug at the hamstrings. Reach for my ankles. Reach for the outside edges of my feet. What I don't want is overactive and over-enthusiastic hip flexors that are pulling my bottom off the ground. If I can put my hand under my sacrum, I want to correct that. I'm going to set everything down, and I'm going to pull those knees in, because you want to imagine if you had a rubber band hooked up onto your ilium and then coming across onto your knee, which you kind of do with the glutes hamstring connection, you want to be pulling that rubber band, creating space in this. And then that rocking is key, because if you keep your sacrum down, you're massaging it a little bit, but also you're telling the joint, let go, it's okay, relax, release, right? Couple of last little twists. One of the things you can do is straighten out one leg, grab the knee, or as you advance in the strap, grab the outside edge of your foot, and then work that into a twist, and then look over that shoulder. Again, your quadratus lumborum, it does a lot of extending of the anterior tilt in the spine, but it also does a lot of twisting. So you want to work one side equally and then the other. And we can work toward a part 2 as we advance in this. So thank you for being here with me. I hope this helps, and we'll see you next time.